If I may come back to you, Fiona, my second question is related to unpaid carers. Of course, we have thousands upon thousands of unpaid carers helping their families every day. I just wondered what you think. Obviously funding is one aspect that's often discussed, but, are there any better mechanisms for supporting unpaid carers in your view?
So you're right, there are 700,000 unpaid carers for people with dementia in the UK. And we know particularly what's happened in the pandemic is that they've been picking up the pieces. So we did an evidence-based report in October that showed that 92 million extra hours had been picked up by family carers during the first lockdown. So they are, absolutely on their knees and exhausted coming out of this pandemic. I think one of the things that can be done for family carers is to see them in the context of this, the reform and the long-term vision, so that they are seen to play a key role. But really importantly, as Jonathan described, in the relationship, so being the daughter, the son, being the husband or wife, not in the context of being the carer or the person who's having to fill in all of the bureaucracy. So again, going back to this long-term vision, what really matters for people with dementia, an important part are those relationships with their loved ones, their relationships with the community. So giving carers the support that they need, cutting down the bureaucracy, helping with the navigation through the system so that they can do the thing that they want to do, which is to have that loving relationship with someone with dementia.
Thank you. And Caroline and Sarah, I'll come to you first, Caroline, then Sarah. Same question again, if that's okay.
Yes, with unpaid carers, and I've been one myself until very recently. Firstly, there's an issue about money. If you give up work to care, as many people do, then you're consigning yourself to being poor later in life. We must do something about carers' allowance. We ought to be trying to support carers to keep working if they can, alongside caring, and to do that we need a different approach to flexible working, which I think may have been accelerated helpfully by the pandemic. But above all, if you talk to most carers, what they really want, they want to do what they're doing. They're doing it because it's what they want to do, but they want some backup and support. And the more reliable the formal care system is, the easier it is for a carer to work alongside it.
Thank you. And Sarah, same question again, please, about unpaid carers.
Yes, I agree. Having a well-funded and reformed social care system will help carers, and we need to make sure that any reforms have carers in there. They're not kind of to one side. I also think that coming out of the COVID crisis, there may be some, this is a shorter term thing, but some case for some direct support for carers who've obviously not been able to access some of the support. They've had perhaps more caring responsibilities because some of the day services and things have been closed and people have not been able to access. And perhaps there is a place for the government to consider what they could do for informal carers coming out of this crisis who've had probably an additional burden and, really probably quite tired and worn out, not because they don't want to do what they're doing, but because they've had to do more of it than ever, perhaps over the last year or more.
What would that look like, if you don't mind me asking, Sarah? What would that extra support be for the unpaid carers?
The thing that people often need is a break, and it doesn't have to be a respite care type break. There are lots of good examples up and down the country. It's not everybody doesn't get what they need, but there are good examples where people provide a direct payment for a carer to do what they want with, to help them have a break in a way that suits them, or where there's a carers hub where you can drop in and access things. So there are examples of good practice, and I suppose you don't need to invent anything new to provide extra support. You just offer a bit more of what you sometimes struggle to deliver.
Thank you. And my very